Let's talk about something that is a truly high-stakes mission, major vascular surgery. It's a lot like launching a really complex aircraft. Success isn't just about the skill of the surgeon, the pilot, if you will. It's about a super meticulous pre-flight check of every single system. So today, we're going to walk through that essential checklist that makes sure the vehicle, the patient, is absolutely ready for takeoff.
And when I say high stakes, I am not kidding. Look at this number. If a patient has a heart attack after one of these big surgeries, their chance of dying within a year skyrockets to 37%. Now compare that to patients who don't have a heart attack. Their rate is way down at around 5%. That huge difference is exactly why this pre-flight check is so critical.
All right, so here's our flight plan. First up, the mission briefing. Then we're heading deep into the engine room. That's the heart. After that, we'll check the key support systems, the lungs and kidneys. Then it's on to fuel and hydraulics, assessing the overall airframe integrity, and finally, we'll see if we're cleared for takeoff.
So every mission has to start with a good briefing, right? For every single patient who's scheduled for an elective vascular surgery, that means getting a baseline assessment. It's basically a full systems check designed to find any hidden risks before the operation even gets started.
This all kicks off with a bunch of blood tests that give us a vital snapshot of what's going on inside. We're looking for any sneaky infections or anemia. We're making sure electrolytes like potassium are perfectly balanced, because if they're off, that's big trouble for the heart. We're also getting a baseline for kidney function, and of course, figuring out how well the patient's blood can clot.
Okay, now for the main event. Let's head into the most critical part of this whole inspection, the engine room, the heart. The stress of surgery puts a massive strain on the cardiovascular system, so you better believe this evaluation is the most intense part of the entire check.
One of the key things we look at here is something called functional capacity, and it's measured in METs, or metabolic equivalents. The easiest way to think about it is this. 1 MET is the energy you use just sitting still. So, this measurement is a really simple but incredibly powerful way to see how much physical stress a person's heart can actually handle.
So what does a capacity of 4 METs look like in the real world? We're not talking about running a marathon here. Can you walk up a couple flights of stairs without getting totally winded? Can you do some light housework? If the answer is yes, that's a fantastic sign that your heart is strong enough for surgery. And in many cases, it means no more cardiac testing is needed.
This brings up a really common question. With the stakes this high, shouldn't every single patient just get a cardiac stress test to be extra safe? Well, the answer might actually surprise you. It's no.
And here's why. It all comes back to those METs we were just talking about. If a patient has good functional capacity, greater than 4 METs, their everyday life is pretty much already a stress test. It's only when their capacity is low, or we just don't know, that doctors will bring in the formal stress testing to get a clearer picture of the risk.
Managing medication is also a huge piece of the puzzle. It's a really delicate balancing act. Some meds, like statins and beta blockers, you absolutely want to continue. They protect the heart. But others, like ACE inhibitors, are usually paused right before surgery. Why? Well, because they can actually increase the risk of blood pressure dropping to dangerous levels during the operation.
All right, the engine is checked out. Now we're moving on to the key life support systems, the lungs and the kidneys. These guys handle oxygen and waste filtration, and they have to be working perfectly under the massive pressure of a major operation. For the lungs, doctors are on the lookout for a number of risk factors. But here's something I think is really powerful. While smoking is a big risk, especially in the 2 months before surgery, if a patient has quit for more than 6 months, their risk profile drops to a level that's similar to someone who never smoked at all. What a motivator.
And what about the kidneys? Well, get this. A full 1/3 of vascular surgery patients already have chronic kidney disease. So the name of the game is protection. This means optimizing electrolytes and, really importantly, minimizing the damage from the contrast dye they use in imaging. Simple things like staying hydrated and using the least harmful agents make a huge difference.
Next up, fuel and hydraulics. This is all about the body's delicate internal chemistry. We're talking about managing how blood clots, how it flows, and how it's fueled by sugar. If any one of these is out of balance, things can go wrong fast.
A lot of these patients are on blood thinners to prevent clots. But obviously, you can't operate on someone whose blood won't clot. The solution is this really elegant process called bridging. You stop the long-acting drug, switch them over to a short-acting one that can be paused right before surgery, and then you just reverse the whole process afterward. It's like walking a tightrope between bleeding and clotting.
And then there's the fuel itself, blood sugar.
And let me be clear, this isn't just a problem for people with diabetes, it's a risk for everyone. Poor glucose control is directly linked to higher rates of death, stroke, and wound infections. The goal is simple: keep those levels stable and below 200 throughout the entire mission.
So far, we've been looking at all the individual components, right? The engine, the life support. But what about the overall structure, the airframe itself? This is where we have to zoom out and assess the patient's total body resilience. And we do that by looking at things like frailty and nutrition.
We hear that word frailty thrown around a lot, and it's really easy to just think it means old. But in medicine, it's a much more specific and much more important concept. It's a weighted measure of patients' real ability to bounce back from a huge stressor, like surgery.
Here's the clinical definition. See, frailty isn't about a number in age. It's about a quantifiable loss of what's called physiologic reserve. Think of it like a phone battery. A healthy person starts with a full charge. But a frail person's battery is already running low, so a big energy drain like surgery is a much bigger deal.
And the impact is just undeniable. This chart makes it perfectly clear. For a major procedure like an aortic aneurysm repair, frail patients are almost twice as likely to have major complications or even die. By assessing frailty, doctors can have a very real, very honest conversation with patients about what their true level of risk is.
Okay, we've checked the engine, the life support, the fuel lines, and the airframe. We've gone through the whole list. Now it's time for that final check. Are we cleared for takeoff?
And at the end of the day, this is the core message of this entire explainer. The absolute best way to reduce risk in a high-stakes mission is through meticulous, obsessive preparation. By systematically checking the heart, the lungs, the kidneys, the blood, and the patient's overall frailty, surgeons can get ahead of problems and optimize every single system for the best possible outcome.
So let's end with this thought. If we can create such a detailed, such a personalized pre-flight check for a single surgery, what does that really tell us about the future of healthcare? To me, it shows a clear path toward a truly personalized medicine, where every single treatment plan is as unique and as carefully considered as the individual patient it's designed for.